Hello, everybody. Thank you so much for joining me today. My name is Amanda Myers, and I will be reviewing the research that was done in partnership with the National Empowerment Center on their training Emotional CPR. This presentation is titled Emotional CPR Shows Promising Evidence of Community-Based Support. So what is emotional CPR? Just as a person's physical heart needs attention in a cardiac crisis, a person's emotional heart needs attention in an emotional crisis. eCPR and the practice of it is a form of heart-to-heart connection for emotional resuscitation. And there are three phases of the practice of eCPR. The first is to connect with compassion and concern, to open up communication, especially heart-to-heart communication. The second is to empower the individual to experience passion and purpose. And lastly, the third is to revitalize, increasing energy, promoting new life, creativity, hope, and an interest in people that are served. So the purpose of eCPR is to aspire to connect through feelings first, respecting each other as equally human and enabling us to be together without fixing, judging, or imposing beliefs, allowing us to explore the unknown together in the present moment, releasing our power to create new voice, new purpose, and new hope. eCPR was originally developed by and for people with a lived experience. So as you'll see to the left here, nothing about us without us. It was created in equal partnership with individuals with that lived experience to gain their valuable input in the training. An advisory group also of culturally diverse peer leaders met regularly by conference calls and gave their input in writing and developing the resource book that goes along with the training. In 2010, the first eCPR training was carried out in Lexington, Kentucky. And the resource book has continued to be developed with new sections added each year. So it is constantly under revision and keeping up with the latest information developed by the team. Evaluation data is collected at the end of each training, and currently there are 80 eCPR trainers throughout 17 states, Puerto Rico, Canada, the United Kingdom, Australia, Germany, Iceland, Singapore, the West Indies, and Poland. There are 7 eCPR training modules. The first is to connect with others. And here, participants are taught how to connect through feelings first, engaging all of their senses, opening their heart, while respecting each other as equally human. They learn the value of engaging in emotional dialogue through expressing and responding to each other's feelings. Second, we have using nonverbal communication. So here participants learn to connect without asking questions or pursuing a story through emphasis on nonverbal dimensions of communication. This could include facial expressions, tone of voice, gesture, and sharing description of bodily sensations. Next, we have cultural empathy across worldviews. Throughout this module, participants learn to validate another person's worldview by entering their frame of reference and sensing their inner meaning. This includes not only awareness of cultural differences, but interconnected social categorizations such as race, class, and gender, however a person defines themselves. Module 4 is learning a trauma-informed approach. So here participants learn about possible causes and types of trauma, as well as ways to heal trauma, understanding that trauma causes alienation, disempowerment, and emotional numbing, while eCPR creates that emotional connection, empowerment, and revitalization. Next, the next module is addressing feelings of mental distress and thoughts of suicide. And this module focuses on discussion of crisis situations, including suicidal thoughts and behaviors, acute stress reactions, extreme or altered states of consciousness, and how you can help. Next, the next module focuses on empowerment, where participants learn that they can facilitate empowerment by being with a person in distress in such a manner that they respect the person as a healer within and they refrain from judging, fixing, or planning for that person. Lastly, we focus on revitalization, where participants learn that mutual revitalization occurs through deep emotional connection, which is experienced by all participants as increased energy, life, creativity, and hope. So how is this relevant? In May 2020, the United Nations called for widespread community psychoeducation, yet few programs existed worldwide. And in wake of COVID-19, we saw increased isolation and loneliness due to social distancing measures. We also saw increased substance use, increased depression and anxiety, increased loss and trauma. All the while, we have a shortage of mental health professionals. So there is a need to move support outside the four walls of a clinical setting. And there's so much more support that we as community members can be providing to each other. So what did we do for this study? We examined the eCPR training program. The training consisted of 3 4-hour days with 2 trainers per training. And this training was delivered online via a HIPAA-compliant video conferencing platform. So 56 trainings were offered between April 20th, 2020 and July 31st, 2020, with each training having about an average of 10 participants. Participants were recruited or invited to attend the training through the networks that the National Empowerment Center already had working relationships with. And that invitation was also posted to the eCPR website for people who were outside of those networks that already existed so that they could express their interest in participating. So the title of the study was Examining the Feasibility and Preliminary Effectiveness of a Virtually Delivered eCPR Program. So online surveys were administered both prior to the eCPR training and upon conclusion of the training. Trainers sent the pre-survey link both via email to the individuals and sent it to them at the start of each training and the conclusions of each training. We asked not only eCPR specific questions, but then we broke our questions down into 4 additional categories. So that was perceived capacity to support individuals, supportive behavior toward individuals with mental health challenges, feelings of belongingness and connection with others, and then symptoms and emotions. And you will see here which evidence-based scales that were reliable and validated we used to measure these categories. So these items were designed based off of the National Empowerment Center's views as the most crucial elements and aims of eCPR, including trauma-informed support, being with another person in crisis, communication, and self-care. And we aimed to explore training participants' agreement with the statements related to emotional support. We also collected descriptive statistics to describe demographic characteristics of the study sample. Then we performed paired sample t-tests to assess differences between pre and post scores for statistical significance. And any and all incomplete survey responses were excluded from analysis. So here's just a screen grab of our descriptive statistics that were collected from our training participants. If you'd like to view it further, you can go ahead and pause your screen, but for now I'm going to move on to the next page. All right, so here we see our eCPR specific survey items, and these questions were rated on a scale of 1 equals strongly agree to 5 equals strongly disagree. Our findings indicate it is feasible for people with a lived experience of a mental health condition to develop a program and train people to deliver eCPR with fidelity. Statistically significant pre and post changes were found related to one's ability to identify emotions, support others in distress, communicate non-verbally, share emotions, and take care of oneself. The p-values here tell us whether an observation is a result of a change that was made or as a result of a random occurrence. And to accept that these changes were observed as a result of the intervention, we wanted our p-value to be below 0.05. So you'll see here the p-values that are marked with an asterisk that are marked as statistically significant. Additionally, we calculated Cohen's d, which represents effect size. So a change may be statistically significant, but Cohen's d measures the magnitude of the experimental effect, and it shows us if the training had a small, medium, or large effect on these changes. So you will also see that marked with 2 asterisks. So here we have eCPR training pre and post changes by measure, and these are based off of the reliable and validated evidence-based scales that we've had. Findings indicate it is feasible for people with a lived experience, like we said, of a mental health condition to develop this program and train others. Here, we showed increases in certain categories. So you'll see if you want to pause your screen here. Statistically significant pre and post changes were found related to feelings of social connectedness, self-perceived flourishing, and positive affect. Findings also indicated promising evidence of pre and post improvements, though they were not statistically significant, related to loneliness, empowerment, active empathic listening, mindfulness awareness, and hope. Of the 560 training participants, 31 individuals participated in one of 2 focus groups in June and July of 2020. Focus groups were held virtually over a HIPAA-compliant video conferencing platform and lasted approximately 1 hour. The focus group interview guide was developed by applying the consolidated framework for implementation research, and data was analyzed using the RADAR method for qualitative data analysis, and then was triangulated amongst authors and member checked for accuracy and maintaining fidelity to the training participants' meaning of their words. So in those focus groups, we found main themes. Here we have 7 main themes. That is eCPR framework, related to eCPR framework, connection in a digital environment, emotional holding and containment, shared experiences, skills practice, training feedback, and implementation. Emotional holding and containment was the most prominent theme, with 27 codes found related to this theme. Holding and containment are essential for healing and recovery. Emotional holding and containment led participants feeling a deeper sense of trust, as they were trusting strangers with their personal stories. They also reported feeling accepted, heard, and seen. Through emotional holding, participants recognized and understood the feelings of people they were working with. Participants reported feeling held and being able to hold somebody in the space that they are in. Participants talked about being connected to other people's feelings and emotions. And Douglas from 2007 defines containment as the ability to receive and understand another's emotional communication, process it, and communicate understanding and recognition back to the other person. Participants reported that they were able to contain others and also felt contained themselves during the trainings. Training feedback was the second most prominent theme, with 25 codes related to this theme. Feedback from participants about the eCPR training experience varied, with both positive and negative feedback. Participants liked the unscripted, unstructured format of the eCPR training and reported that the format allowed them to just be witnesses to the training and to be present in that moment for what was happening in that moment. One participant did share the following comments, saying, it was a complete kind of 180 degrees for me from everything else that I have learned, as far as mutuality and as far as the sharing a lived experience and having that peer support. eCPR is basically you're just there. However it goes, you are just there with it. So with that, it was a little bit different from the peer support training that I initially had. No other trainings I had. It was so refreshing and something that I did not think that I could use in my current job going in. But once I took a deeper dive, and we had 3 different sessions, it clicked. Though several participants preferred the unstructured format, some participants did suggest that there are some concrete instructions about eCPR in the training and the planned activities, and that these would have helped them to prepare. Our third most prominent theme was the eCPR framework. We identified 16 codes related to this framework, and participants understood the eCPR framework as interacting with others, or for interacting with others. Participants noted that they found the training empowering as it provided a freedom to practice with no expectations to fix somebody or to find a solution for somebody else's problems. Participants described the lack of concreteness in the training framework and a lack of script on how to conduct the intervention as freeing. They found the eCPR training framework to be easy and that it led to a positive experience and deeper connections. Here, if you would like to pause your screen, we have selected quotes related to each of the main themes. So this study aimed to examine participants' experiences after attending the eCPR online training. Our findings suggest that participants found the eCPR training to be a valuable resource for learning new skills when engaging with an individual that may be experiencing a mental health crisis. Analysis of the focus group discussions regarding participants' experience with the eCPR training highlighted 7 main themes, as we already saw on the screen. Many participants appreciated the format of the eCPR training with a hands-on experience and expressed relief and feelings of freedom to practice eCPR teachings and use the eCPR framework without having to fix or always be solution-driven. Additionally, participants reported an increased ability to connect with others on an emotional level, even on an online platform. They reported newfound active listening skills and how to emotionally hold someone in their time of distress and need. Future steps could include evaluating the effects of an online versus in-person training, examining eCPR in other countries that it is implemented in, such as Poland, evaluating the effects of eCPR on subsets of the population, such as by role, age, race, mental health diagnosis. Additionally, we could evaluate the impact of implementing an eCPR and the impact that it has on community mental health, such as levels of anxiety, depression, and distress, or feelings of loneliness, isolation, and suicidality. And lastly, we could examine the impacts of increased hope, positive affect, flourishing, and decreased loneliness on the daily life of eCPR training participants. We have seen that the online training increases these factors, but what does that translate to in their everyday lives? Thank you so much for listening to this presentation. My email is up there at the top, as well as my co-researcher, Shira Collings. So if you have any questions, please feel free to reach out to either of us. Additionally, if you have any questions about the eCPR training program, you can email info@emotional.cpr.org.